A lot of times cancers develop in between your annual mammogram, and that's why it's important on top of the annual mammogram to do a monthly self-breast exam just to get to know your breast. Hi, I'm Dr. Robyn Roth. I'm a diagnostic radiologist specializing in women's imaging at MD Anderson Cancer Center at Cooper. So as a women's imager, I specialize mainly in breast health and breast cancer screening. So we interpret screening mammograms. We help the workup of a woman who has a suspicious abnormality. We do the biopsies, and we also deliver results. So we are the ones who are diagnosing women with breast cancer. So most societies recommend starting routine annual screening mammography beginning at age 40 for average risk women. Women who are higher risk would need to start earlier and possibly have supplemental screening. The baseline mammogram is so important so we could establish what your breast looks like and make sure that there's nothing at baseline that's concerning. And then every year we get to know your breast. So we like to have comparisons. Over time we get to know, oh, that's just how her breast looks. So it's really important to come every year. I always approach patient care, especially with women's imaging, like I'd be treating my mom or my sister. I think that's a really important relationship that you're developing, and ultimately we could possibly be diagnosing with breast cancer. So we're really trying to establish trust early on. So I make sure to listen to their concerns and their fears and their anxieties, and walk them through the process. The most rewarding part of my job is that I'm meeting people at the lowest part of potentially of their health journey, and they're getting a diagnosis of breast cancer, and often I'll see them a year or two later. I'll run into them at Wegmans and they'll say, "You really helped me through such a hard time in my life, and thank you so much." And honestly, nothing warms my heart more than seeing somebody that I've diagnosed with breast cancer thriving.